What's up, everybody? This is Kevin.
This is Ryan.
And this is Becca.
And you're listening to the GenSTEM podcast.
The one and only STEM podcast.
For young professionals.
By young professionals.
Join in on our free-flowing conversations.
Where we break down all things STEM.
In an easy, fun, and digestible way.
We are
Generation STEM.
Welcome, everybody, to episode 3 of the GenSTEM podcast, formerly known as the Close of Business podcast.
If you're just now joining us for the first time, we'll give you a quick catch up with who we are and what this podcast is about. So currently it's just Kevin Flaker and myself, Becca Schmidt, on a Teams call doing this quick intro right now. And then we've got our third host, Ryan Carlin, who is normally on the episodes with us, but he wasn't able to join on the interview, the bulk of this episode today. So Kevin and I are the ones just leading it in. We're 3 engineers who work at Black & Beach, but we're also 3 what we'd like to consider just normal millennial human beings who kind of just don't necessarily fit the typical stereotype of what engineers are. And this podcast was just inspired by the conversations that we have about cool things going on in the STEM world, just as conversations as friends. So this podcast is just about introducing, important, informative STEM topics, but just talking about it in our free-flowing, kind of easily digestible type way.
Yeah, I think a great way to describe what the podcast is and it's going to be stolen from an interview, something that Morgan Waller on the interview this episode continues to say is we're perpetually curious. And we thought it'd be a great idea to kind of start a podcast as we indulge those curiosities when relating to the STEM industry.
Yeah, but as we're hanging out over beers.
Yeah. Speaking of which, we've got a great episode, as mentioned at the front of the episode. It's episode 3. And the past couple episodes have been focused around and loosely related to the COVID-19 pandemic, since it's such a central part of everyone's lives right now. Right. And on this episode, we brought on, kind of fell into our laps, an interview with Morgan Waller, who is the director of telemedicine at Children's Mercy Hospital here in Kansas City. And if you were listening to the last episode, you may have heard that we mentioned how big the industry of telemedicine is booming, or how much it's booming right now. Obviously, with the social distancing and people still needing healthcare, this is an obvious solution. So we're really lucky and super excited to have been able to speak to Morgan. She brought on a lot of great insights into the industry, as well as the technology that it takes to do something like telemedicine. And to be honest, I learned a lot. Telemedicine is completely different than what I originally thought. And I think the future is extremely exciting.
For sure. And I think when you guys listen into this interview, it also kind of it's a nod towards what this podcast is about. You'll hear us asking questions we're not necessarily, when we bring people on these episodes, we're also learning at the same time you guys are when we're listening. So you'll hear us ask a bunch of questions, and Kevin and I learned a ton from Morgan. She's super engaging. We told her that we're going to have her on more episodes in the future just to shoot the shit and talk about technology developments in the world of medicine, which we're really excited about. So listen up. The interview's awesome, and hope you enjoy. Welcome, everybody. We're here today with Morgan Waller, the director of telemedicine at Children's Mercy Hospital. Welcome, Morgan. We're excited to have you here today.
Thank you for having me.
We're going to be doing a discussion about telehealth and telemedicine, which we thought was really pertinent based on the current global climate with the COVID-19 pandemic. And so we're really excited to talk about that, and then also dig into your background a little bit, Morgan. Based on the feedback we got on your career background, we're excited to learn about how you ended up as the director of telemedicine. So we'll touch on that as well.
Before we get into that, we like to kind of break the ice a little bit with all of our guests. And pre-COVID-19, we had all these fun questions hey, what are your favorite hobbies? What do you like doing? But since nobody's really doing anything now, I guess I just would like to hear personally, I'm assuming you're working in the hospital and you're an essential employee. So how has the COVID-19 pandemic really disrupted your life and your work routine?
Well, certainly I want to consider myself essential. However, I am the director of telemedicine, which implies if I cannot work virtually, I'm not walking the talk very well.
That's a very good point.
I am working from home and my entire team is working from home. So COVID
proof of concept. Yeah, proof of concept.
Right. We were very well prepared for that. Other hospital colleagues. So just that shift and the fact that my husband and both of my teenage girls have been home 24/7 for the last 40 days. That's disruptive.
Yeah, I imagine. Give us 2 hobbies or 2 activities that you're most looking forward to getting back to. When this the lockdown lifts, you're going to go do what?
Well, I actually have thrived kind of with this because I can be a homebody. But I am looking forward to, hopefully, if there will still be movie theaters, they won't have all gone bankrupt. Definitely looking forward to that. And just interacting with people in social settings. That's probably number one.
Oh, yes. That hits home really hard for me. I'm a hardcore extrovert. So that hits home for me.
Me and my friend group have already planned like 4 or 5 weekends, like back to back to back, starting at the end of May of just activities. So I'm extremely excited. Hopefully nothing gets extended, but with that, I guess let's get right into the very first question, and that is, what is telehealth or telemedicine? Explain it to a 7-year-old or 27-year-old who has never heard of the concept.
Okay, well, first of all, we can make it easy. Telehealth and telemedicine are, for the most part, completely interchangeable terms. Years ago, there used to be some attempts to make a distinction, and some people still do that, but it just complicates things. Telehealth would include things like education and maybe even exercise programs over video, but also very much could be your medication management routine. And so the two just really are interchangeable, have blended together. And it's not a specialty in and of itself. So it's a way of delivering healthcare when the patient and the provider cannot be in the same place at the same time. It's that simple.
So in general, how does it work for patients? How do you set up an appointment? Do you, at least with your experience at Children's Mercy, do you do a FaceTime call from an iPad, or do you just talk to your physician over the phone? Could you give us a little just, roll through of kind of what that process looks like?
Sure. So within the fact that those two terms are interchangeable and it's a simple definition, there's not just one type of technology or process that meets all of the needs in healthcare. Okay. So we do a variety of those things that you just suggested. Prior to COVID, our where we had achieved most of our success was with highly specialized appointments at 4 regional outreach centers that are just like a clinic you would go to in the metropolitan area, and you wouldn't know that it wasn't your doctor's office. They're branded Children's Mercy, and there are nurses and care assistants and access reps. Instead of seeing the provider in person, we have these robot-like video conferencing and high-definition digital ancillary devices that allow the provider and the patient to interact, from across the street or across the world. And there's a nurse there that helps facilitate that. So you can ask questions and the provider can go through their whole assessment with the nurse there using those digital ancillary exam devices. So we were able to achieve some of the highest level of encounters with some of the most highly sought after specialists. So truly improving access to these providers. But then COVID changed things a little bit and we had to move on to some other options.
Right.
So I guess and I don't know if this is like rural areas or is this just like anywhere in the KC metro area, I would go to just some corner office or across the world. I just go into some corner office and I'd talk to pretty much a robot with an iPad for a face. And this is specifically for a specialist because there's maybe 1 or 2 doctors that are specialized in this field or, available for Children's Mercy. And instead of me having to travel hundreds of thousands of miles, I would go to this office, talk to them via a robot with a nurse as kind of like an in-between.
An assistant and liaison.
Yes, we call them, right, telefacilitators. Because we are so focused on quality, they are all BSN RNs, and they're specially trained because they represent and facilitate up to 33 different specialties. So they have to be able to assist, right, with lots of different specialized exams. And you're right, maybe not the hundreds of thousands of miles, although Children's Mercy does have a couple of specialists that are the only ones in the world. But certainly from Western Kansas or Middle Missouri, they don't have to drive. And things like pediatric rheumatology, there's only like 400 board certified pediatric rheumatologists in the entire country. And I can assure you they're not all drawn to the Midwest to practice. So that's a big help for kiddos.
So for us, when we get to interview people like you and we're learning about new technologies in the STEM industry, in a lot of cases, we're interviewing you and we don't know a lot about the subject. And I think that you kind of like painted a very clear picture that was different than what I had dreamed up in my brain about how the telehealth system worked, I suppose. So it's interesting. I guess I imagined it just being a FaceTime conversation via a phone or video conversation via a laptop or something like that with a physician. So this is a lot more detailed care than that.
Definitely. This is extremely detailed because we wanted to be able to replicate in healthcare. There's for billing purposes and to indicate the complexity of the appointment, there's like 5 levels. And we wanted to be able to replicate a level 5 encounter with the same standards that we have in person. And in order to do that, we needed some really robust technology. We use InTouch Healthcare for our solutions, and the ancillary high definition devices allow the provider in real time to see inside the patient's ear, for example, also to listen to lung sounds regardless of distance. We've actually in the past had providers that were in Saudi Arabia or in Portugal that saw patients in Missouri and Kansas because they were our physicians, and they could hear breath sounds 3,000 miles away.
That's crazy.
And this is the nurse that's like maybe looking in your ear or putting the
instrument,
stethoscope. Yes. I don't know.
Right.
Whatever
and
the heart.
Speaking to the technology piece, that also adds a bonus, which I try to say that sometimes telehealth appointments can be better than in-person appointments, because the parents can also see, because when the nurse holds the otoscope, for example, in the patient's ear, she gets a little video of what she's looking at. So the parents can see that, which is on the slave monitor, if you will, the robot display, as well as the provider. And so you can talk about it and the patient and parents can see.
So my mind's already racing and about to take us off track. So
yeah, same.
It's easy to do, and I can talk about this all day long. So
great.
Let's go. So you're mentioning like these specialty cases, and you also mentioned like COVID maybe changed the game, and I think we want to get to that a little later on in the episode. But like Becca said, I kind of had a different idea, and maybe these are future implementations, or maybe these are just different implementations than what Children's Mercy is doing. But I always kind of thought like, hey, what's the point in me, a healthy, strapping young man, going into a doctor's office and wasting like 2 hours of my time getting a physical to be in, paying whatever the copay and all that is, when I could just maybe do the same virtually and like from a phone? Is that even a thing, or did my mind just kind of lead me down the wrong path there?
No. So I think the key point there is, we are a specialty children's hospital. So that takes up the game. But we also have a program that is exactly like what you're talking about. And like I said, there's not just one process or one technology that meets the needs of healthcare virtually. So I kind of, covered the specialty stuff that we do and what we've really achieved a lot of success in and published a fair amount on. Now, we also offer an alternative to urgent care and the fact that there aren't often options after hours for kiddos who get sick, which is usually when they get sick. Nobody ever.
Nighttime.
Exactly. And that's true, even for adults. It always seems like it's the evening time when you fall apart. So rather than having to go to an urgent care or an emergency department for something that's not an emergency, but yet you're in enough discomfort that you don't want to wait till the next day, we have what is called a direct-to-consumer or direct-to-patient platform, which is what you guys have been talking about, where on the patient side is an iPhone or an iPad or, desktop computer, whatever they have, and then they reach a provider in real time. So they, sign into the application and reach the provider and, say, this is my complaint, and an interview ensues. And it's done at Children's Mercy. We use video and audio. Sometimes there is a need or the needs can be met with just a phone call, but that's not the normal way that we practice. We almost always use video.
So you talked about these kind of like virtual clinics, I guess is what I'll call them. I don't know if that's the correct term, that patients can go and have the consultation with a specialist. I mean, this is new information to me. I didn't know that this system existed. Could you give us a little background on the time frame on how long you've been working on this and how long clinics like this have been in the works?
So we started at Children's Mercy using that model. And I will say, not to brag, but we are a little bit of pioneer in this area.
You're trailblazer, yep.
Especially among children's hospitals. So we started 2012 was when we really got serious about starting this. We had one patient, but we knew one telemedicine patient at that time. We had over 4,000 encounters last year, but
oh wow! And
right now we're doing 69% of our total visits due to COVID, but we can talk about that more later. So in 2012, we knew that we had some challenges with access, like all specialty physicians in the world, really. There's not enough to go around, and it's expensive to send a group of providers, nurse support, equipment, rent, a place, and have everybody load up in an RV and head out to do a clinic. That's really expensive. So what were the options? And so Children's Mercy started looking at renting or owning, adapting clinics with our brand in some regional outreach locations, Wichita, Joplin, St. Joe, and we now have one in Junction City. Mm-hmm. So patients can go there, have the complete experience, and the difference is the providers are there virtually. Okay. So it was a challenge. I'm not going to lie. We could do a whole other podcast on.
Oh, I'm sure. I imagine all of the logistics of that would be, that's a difficult process. So, and you're saying this started around 2012. I mean, that's only 8 years. And in my opinion, to develop an infrastructure like that so that quickly is pretty impressive. So then the next question I kind of wanted to ask is, what has the evolution of these clinics kind of been like? And, what did they look like initially? And then what technologies have started, being implemented over time?
When I first started, I worked with a part-time medical director who found In Touch Health out of Santa Barbara. And we started with their technology from the very beginning. And really, they are an interesting engineering, entrepreneurial, innovative company in and of themselves.
You said all the buzzwords. Yes. I love it.
and I'm not big into buzzwords. They really are the real deal. And they have also some altruistic motivation, which is nice because you don't always see that. I truly believe that they want to improve the health of, the world because they're an international company. But their solution was just better. It was like, the Ferrari of telemedicine because there were a lot of connectivity issues, especially 8 years ago. And so we started out, but we just didn't have the volume. So, here we are, and we only had one or two doctors that were, excited to do this. And then strategy wanted us to implement different specialties that had no interest in doing telemedicine. So that speaks to some of the barriers which people in STEM encounter whenever you want to do something new. It doesn't matter what it is. There's
always objection. Yeah.
Oh yeah. Tons of reasons why this can't be done.
Yeah. You're talking to two engineers who work at, 100-year-old engineering firm. And we know what it's like working with other people in STEM and their averseness to change.
Yeah. So there was a lot of that. And I'm incredibly persistent, tenacious, pushy, downright mean and nasty, whatever, whatever it takes. Because I was really serious about this, that I could see, and I had a couple of, role models and got into this niche industry that just fit all of my backgrounds and my passion for efficiency and simplicity and people's health. So it was just super good match for me. And we just kept knocking down the barriers. And I have some pretty graphs that show how we grew the numbers of patients that were having encounters at these 4 regional outreach locations, and also the number of providers to where, like I said, we did over 4,000 encounters last year, and we have 33 different specialties that are offering this service. The 33 specialties and the volume puts us easily within the top 5 children's hospitals in the nation regarding this type of telemedicine, for sure.
Wow. So if I was to walk into the first clinic in 2012, what would I have seen? What kind of setup would have there been, and what technologies were available at the time?
So you walked in, and there would have a small waiting room and maybe one other person there, an access rep that would have greeted you, and then they would have called you back for your appointment, much like what is done in an in-person clinic. In the room would have, and still is, a robot looking, because you can't drive it remotely, you have to push it around. But so that makes the difference. This company does make robots too that you can drive around, but these are ones we have to push on wheels. So, and it has a nice size video monitor on it, which has picture-in-picture, and then it's on a telescoped arm, and it has a hand tilt zoom camera for the provider, so the provider can really zoom in on the patient, or can open it wide up and see the family and everyone else in the room. Mm-hmm. Attached to it is like a phone, so if the nurse needs to have a semi-private conversation with the provider, that can be done. And then a stethoscope hangs from it that can be used to listen to breath sounds and heart tones. And then the other devices, which change out heads now, the technology's evolved. We used to have a different otoscope and dermoscope and ophthalmoscope. And now the devices have evolved to where you just switch out the heads. So that makes it nice. You have one wand, and then you can switch out your cameras for whichever need you have. But everything else in the room would have looked like a clinic exam room.
So essentially the base technology, like the robot itself, has stayed the same throughout the years, but the attachments to the robot is what you've seen develop over the years, as well as the numbers in the clinic.
Yes, and as with all things, those robot-like devices have changed out in 8 years. We've actually had to retire some because they were end of life. So the technology within those has also changed, and the footprint is a little smaller. So the same awesome technology, but the device itself isn't quite as heavy and big.
Okay.
I'm for sure gonna once we're done with this conversation, I'm gonna Google what these look like because I'm uber curious. I'm uber curious now.
So I guess I have a question. Obviously, the remote access to specialists is a huge benefit. What are some of the other benefits? I guess are there any cost savings that, maybe not for these particular visits because they're specialists, but in the industry in general, do you see like if there are other uses for telemedicine, would the consumer see any kind of cost savings not having to go to a physical office? And, maybe it's less of the doctor's time. They're able to do it from, maybe the comfort of their home office.
Certainly. So you have the access, but along with that, for the patient and family side of things, which in pediatrics are kind of interchangeable terms, but they don't have to drive, which is not only a nuisance, but if you are not a salaried employee, maybe you can't take off time. And if your kid has a chronic condition that needs to see a specialist and you have to see that specialist every quarter, for example, that's a big deal. So you're losing income and having to negotiate time off during the week. If you have other kids, someone has to watch them or you have to take them with you. So the role functioning costs of traveling to see a specialist are saved if you have a telemedicine option. And then the expense of travel, and then just the inconvenience of the whole thing. Yeah. Parking, and driving around them. If you're from a rural area, we have a location in St. Joe which some people have said, well, that's just, 45-minute drive away. Well, there's a lot of people in St. Joe that don't want to come inside the 435. Mm-hmm. Driving inside the city makes them very uncomfortable. So they're like, oh, this is so awesome. We don't have to face the traffic in Kansas City.
Right.
So in general, what kind of disruptions have you seen due to COVID-19? I guess my gut reaction, because, healthcare is an essential service to me, I couldn't come up clearly with what changes would have happened during the pandemic, but do you want to describe some of the impacts that you've seen?
Well, and it's been huge, and not just Children's Mercy. There are actually, as a result of COVID, there are hundreds, probably thousands of hospitals across the nation that have had to furlough employees, which furloughing nurses is a non-heard of event. That just does not happen. Nurses are in demand. There's, my entire nursing career, there's been forecasts of nursing shortages. So
oh yeah, all my friends that are nurses talk about how they struggle with their their hospitals being short-staffed during regular times. So
right. So this is just unprecedented to have nurses being laid off. But what happened, hospitals are inherently filled with people. And so one of the first things under the national state of emergency was the order to cancel all non-emergent surgeries. So elective surgeries were stopped. And there's a broad definition of elective surgery. So, that could, I think, some states consider, hip replacement an elective surgery. So there were, at any rate, massive cancellations of surgeries, which then cancels pre-op and post-op clinic visits, and then also non-urgent, emergent healthcare, routine healthcare encounters. So we immediately went to canceling and only seeing patients in person that was medically necessary, and that included our outreach locations where our telefacilitators work. Because, those patients would be going into those clinics. The providers wouldn't be interacting physically with the patient, but other people would. So all follow-up appointments that were non-urgent canceled. But then there became this huge need to meet the ongoing needs of patients, because what on earth would we be able to do after 40 days of not seeing all of those follow-up appointments when we were anywhere between 25 and 2,700 clinic appointments a day? How were we going to possibly get all those people back in?
Yeah.
Wow. Yeah. Wow.
We pivoted to adding the in-home telemedicine. And another reason for that is because insurers were mandated that they had to reimburse for telemedicine in the home. Not all states and Medicare, they won't pay for any telemedicine that's done in the home. They have very specific guidelines for certain things that can be reimbursed if they're done via telemedicine in the home. So that's traditionally been a barrier. Now with COVID, all of that went away. And so we were able to offer these follow-up visits in all of our specialties to patients in the home. And within 2 weeks, we had every one of our specialties, 51, including allied health, were seeing their patients in the home. I didn't sleep those 2 weeks.
Oh, I'm sure you didn't.
Do you think all of these changes, waivers, regulations that have come about because of COVID-19, do you think that the, I guess, general perception is going to change post COVID-19, or do you think it's going to go back to normal in regards to this new direct-to-consumer telemedicine?
Nothing ever could have driven the adoption of telemedicine and the awareness of telemedicine by consumers like this pandemic has.
Right.
So, CMS data, the last published reports that I saw were like from 2016, and only 1% of the reimbursements issued by Medicare and Medicaid were for telehealth or telemedicine visits. 1%. That's nothing. So that just demonstrates, even though it's very fashionable, and certainly if you work in telemedicine, you seem like the whole world is virtual, but it's the reality is that's not the case. And so we have, the industry itself has worked really hard to get the federal and state barriers, if you will, to telemedicine that exist because some of the laws and things were literally enacted before there was the technology to allow this type of healthcare delivery. So some of them just don't make sense, but they haven't been removed. It's like the no eating ice cream on Sunday. If nobody takes it off the books, it's still there. So I think that it will be I don't think that we're just going to have telemedicine free for all. I do think that states and the government will return, but I think there will be so much pressure and demand from the providers, the physicians and nurses and advanced practice nurses, as well as consumers, that it's not going to go back just to the way it was before.
Mm-hmm. Just in general, moving forward, kind of what is your vision for what the telehealth system for Children's Mercy will look like another 8 years from now? What technologies do you want to have implemented, or what do you see the future as being?
One of the questions that I get asked a lot is, what specialties or what types of appointments can be done via telemedicine? Mm-hmm. And really, it's a shorter list to say what can't be done. And even that, with robotic surgery, you can't even just say, well, you have to be there in person for surgery. Well, not necessarily. The surgeon doesn't have to. So I see us evolving more and more in having a virtual presence with each of our specialties, the ability to use, if it is a telephone to meet the need, or if it's an email or a text message, that the technology matches the need of the patient. Mm-hmm. So no more of this driving 6 hours across Kansas for an appointment that you had to make 6 months ago to get in to see a pediatric dermatologist, waiting, trying to park, and finding out that you were referred for a freckle, that your child does not have skin cancer, but has a nevi, which is a fancy name for freckle, that we can take a picture of that. The pediatrician or the family practice doctor in Western Kansas could take a picture of that, and the dermatologist could take a look at it. That'd be asynchronous telemedicine. Mm-hmm. And then report back that no need for this child to come in. So that we match the virtual technologies with the need up to this complex situation that we have in these regional outreach facilities where a full exam can be done with a new patient, with, super subspecialist, or an in-person, exam. I want us to work more with other organizations, other children's hospitals. So when we have a lot of the world's most amazing pediatric specialty providers, but there are other children's hospitals that have some that do things that maybe our providers don't, and vice versa. So why can't we get our kids in our organization to be able to have a telemedicine visit with, say, a specialist at Children's in Boston for that super micro specialty need? And then on the home front, there will be devices that, allow families to look inside the ears and portray that in a direct-to-consumer, direct-to-patient platform scenario. So say your kid just got tubes placed for chronic ear infections. You're sent home with one of these devices that you can show the provider what the inside of the ear looks like from the comfort of your couch without having to come in for the follow-up appointment.
Yes, that's dope. I guess in your wildest dreams, with the onset of mixed reality, talking about augmented reality and virtual reality, have you or anyone from your team, or maybe just in the industry in general, but have you guys looked into implementing these kinds of technologies into the telehealth practices?
We have played around with Google Glass and some virtual reality, and I think it's not very far-fetched to assume that our providers could take the form of holograms. So when you're having your telemedicine encounter, that the provider could be in your living room with you in the form of a hologram. I really don't think that's very far off. And then artificial intelligence, or whatever, you want to call it, being able to learn from all of the big data that healthcare creates. One of the things that I'm a little miffed about is the fact that our electronic health records haven't done the best job talking to one another. So if you are Epic or Cerner, the fields are not the same. So if you want to do a giant, although you could easily do big data from each of those systems individually, but looking at what are the unanticipated findings to maybe better drill down on this. Why do some people get COVID and it kills them, and other people get it and don't even know they've had it? There's something there that big data could unveil.
Yeah, analyze. And I was even thinking back to your example of the freckle, is you have some type of app that you open it up and you scan it, and it can either project something on your skin that you can narrow the field view so it knows where to focus. And, if you guys have all these photos of a cancerous versus a non-cancerous freckle, not to be in non-medical terms, you could have AI analyze photos of cancerous versus non-cancerous to where you can have an app give you an answer hey, should I be worried about this freckle or mole? And that should be an app, period. Not even with you. I'm just thinking maybe I need to develop this app to where you can just
trademark that one, Kevin.
Yeah, TM. To where you can just take a photo of your back.
That's all right. Great idea.
Does that exist? Do you know if that exists? Should I develop this?
I think that there are some things in the works very close to what you just described. But,
Kevin, you're behind the ball.
There's a lot of AI in radiology, looking at having computers read X-rays. So
I've got another idea, because I just love thinking about these possibilities. So when we were planning this, and this is the furthest thing from what it turns out telemedicine is, but I was thinking what if me and my buddies, and this comes from a true story, I was hiking up in the mountains in Colorado and almost stepped dead on a rattlesnake, and by very lucky jump. I jumped out of the way and didn't get bit at all. But if I would have gotten bit, like I would have been dead. What if like I get bit or something happens to me in a remote location? I'm able to pull up an app, and let's say the emergency relates to your hospital. I pull up an app and I can select the area, connect to the physician, and they're able to provide me emergency, like, hey, and this is the example I gave Becca. I don't know, like kind of a MacGyver, like, hey, you see that tree, grab a branch, snap it, tie it to your leg to give you some support if you broke a bone, or hey, you got venom, tie off the flow with a belt to your leg. Like, is that something you guys do you see as a future of telemedicine?
And then geolocate you and come pick you up in an airlift.
Yeah, obviously, like emergency would follow up later, but they could at least, like, if you're from a gunshot wound or you fallen, they're like, hey, okay, this is what you need to do. Like rest, ice, elevate, or like what I'm talking about.
No, that everything you just described exists now, as long as you have some sort of Wi-Fi or cellular connection. So, one of the challenges with your hiking scenario there is, the ability to connect to a provider. But you could do that before your next outing. There are a lot of telemedicine companies that work quite differently than a children's hospital or a hospital in general. These are, for-profit companies that have set up business, and the providers work from home, which offers great, flexibility, lifestyle, compromise, retaining talent for people who don't want to work full time or want to retire but don't want to retire completely. And you have the app on your phone, and for $50, you can connect within 5 minutes. And I'm talking from the time it takes to download the app. This stuff is so simple anymore.
Wow.
You can be talking to a physician that can tell you, hopefully you get the one that's got some expertise in hiking and rattlesnakes and
yeah, right.
A little bark, but yeah.
So that does exist. Okay.
It absolutely does.
What are some other cool things? What are some other really cool things that exist that we might not be thinking of that gets you excited when you look at the future of telemedicine?
It's just going to be healthcare. So it won't be called telemedicine anymore after a while. It'll just be the way healthcare is done. And there's as many things as there are that are fabulous about healthcare in the US and the world. There's just as many that are jacked up. So there's so much room for improvement and efficiency and cost savings. Hopefully, as technology continues to grow, some of this stuff is getting less expensive every 3 months. And so we'll be able to apply some of this stuff and truly help people, empower people to take care of their own health better at a reduced cost and have better access, like you said, for the times when you really, really do need it.
Absolutely.
5G will help a lot too, as far as addressing that connectivity and access issue that I was referring to.
Yeah.
Because sometimes you do need to see, just being able to hear is not enough. So it's going to become, can you see me, not just can you hear me?
Mm-hmm. And we actually did an episode on 5G talking about how that's going to help and what that enables. And I don't even know if we mentioned it, but yeah, telemedicine industry is something that could just be blown open with the onset of 5G.
Mm-hmm. Absolutely. Yes. But if you guys are not familiar with Singularity University.
Oh my goodness.
Funny you mention it. We actually went to the Global Summit last year. And we interviewed a few folks for this podcast. So we've got some good interviews with folks who attended the conference.
Yeah, so absolutely love those people. And, besides telemedicine, I'm super excited what nanotechnology is going to do for healthcare. And there's so many things.
Endless opportunities with all of the technology and development right now.
Are you saying you've got a pulse on all these other technologies? Do we need to bring you back on to talk about some of those in regards to medicine?
I'm not an expert in the other stuff, but I have an interest. I am fascinated by the adoption curve and why there are, people who so resist advancements in technologies that I can't help but being drawn to the other stuff. It just, it's part of my nature. I'm perpetually curious and want to understand why healthcare, especially, and part of it is, money is a big driver for so many things because some other industries have done a better job of embracing technology. And we weren't even very good at video conferencing at the hospital until a few years ago. So,
right. We have had a really awesome conversation so far that we filled up pretty much the whole hour. So I think probably just for duration's sake, we should probably go ahead and wrap up. But in general, like Kevin mentioned, I feel like we have just hit the tip of the iceberg with you with the different discussions that we can have regarding implementation of technology in the healthcare system, and also just in general your background. We would love to get to know a little bit more about how you ended up where you did. So more than likely, we if you had fun with us, we'd love for you to come back on with us again.
I would love to. Being part of that, being perpetually curious is also anything I can share so people are not spending their time, building something that's already been done. I'm always happy to share.
Cough, Kevin.
I'd rather learn from someone than, struggle to do it all, myself again. So Happy to share.
Absolutely. Well, thank you so much for joining us today. This was an awesome conversation. You've got me all jazzed up about the future of telemedicine and the future of healthcare. So thank you for that and your wonderful insights.
Well, thank you guys. And Kevin, make sure you download an app before you go.
I will do.
All right. Thanks.
Thanks for tuning in today, you guys. For more episodes, find us anywhere you listen to podcasts by searching Generation STEM Podcast. Hit us up on social media at our handle at GenSTEM Podcast, or visit us at our website at genstempodcast.com. As always, stay curious, friends, and tune in with us next time.